measure CMS 438, statin therapy for the prevention and treatment of cardiovascular disease. This is a telehealth eligible measure. The definition of this measure is the percentage of patients who are prescribed or are on statin who have the following criteria. 1, all patients previously diagnosed with or currently have an active diagnosis of any type of ASCVD, clinical atherosclerotic cardiovascular disease. This includes coronary syndromes, history of MI, stable or unstable angina, history of ASCVD procedures, stroke or TIAs, and peripheral vascular disease. It also includes patients age greater than 20 who have an LDL greater than or equal to 190 or familial hypercholesterolemia, and all patients between the ages of 40 and 75 years of age with a diagnosis of type 1 or type 2 diabetes. The workflow for this measure is as follows. For any patient that meets the aforementioned criteria, you're going to check that the medication list has a statin in it. And once the medication is added correctly, including the dosage and directions, it's marked as being taken currently, and the medication list is verified. This measure has been met. If you are newly prescribing a statin medication or providing the patient with samples, as long as you e-prescribe the medication and it becomes there is an electronic record of it in the EMR, you have met this measure. There are several exclusions for this measure, which include reasons why patients could not be on a statin: pregnancy, rhabdomyolysis, any statin-associated muscle syndromes, allergy or intolerance, liver disease or hospice, etc. If the patient has an allergy to the medication, it is not enough to list it in allergies. The exclusion must be marked in a structured format. There are 2 places where you can put this in the EMR. It's not covered in our right chart panel, so there are 2 other places you can put it in. One, when you're finished the encounter with the patient, you can go into visit code, and under add CPT, you'll see in this left-hand column here, under macro exclusions, statin use exclusion. If this is selected and linked to the patient's coronary disease diagnosis, that will exclude the patient from the measure. The other place you can put it in is under examination. In the left column here, under CQM exceptions, the very first one, you'll say statin therapy not given. If you click on it, the notes, and you select the reason, this is another way that you can exclude the patient from this measure. That is the end of this measure. Thank you for your attention.